I'm going to talk about nutrition for the pregnant female. So I'm going to talk about it in 3 different ways. I'm going to talk about it while pregnant, how to hold the baby, and replenishing the mother post-delivery. I do some pretty much infertility, natural infertility. And during the last 11 years, 12 years, whatever, since I've been doing it this way, we have an astounding 100% success rate on women who follow through. Now, there's been 2 or 3 women that didn't follow through, of course, doesn't count. But women who had PCOS, women who failed in vitro, all this stuff, we've been successful. So we're gonna take a look. So while pregnant, that's what we're doing today. There's gonna be 2 other videos. Calcium lactate, number 1. The baby is gonna leach calcium from the mother. So we need to give calcium lactate, not calcium carbonate, not calcium citrate. Calcium carbonate's from limestone, it's rock. You never wanna take that. So calcium lactate. Secondly, iron. The baby's also going to be borrowing iron from the mother. So what iron do we need? Well, first of all, iron that comes from food. And second of all, a food supplement is ferrous lactate. Just remember, just like calcium lactate, it'd be ferrous lactate. Ferrous meaning iron. And so that's what you want to give the baby. That's a food. So when we give ferrous lactate, when we want to raise iron levels in the body and ferritin levels, it raises it really easy. So iodine, you're going to see a bunch of, if you look on the internet, a bunch of misinformation about iodine. But we're talking about iodine that's bound with protein. And that's something the baby needs. Mental retardation, iodine deficiency. So let's cut that off. Let's prevent those type of things. Trace minerals, we want to get the mother all the trace minerals because hormonal system's working overtime. Fish oil, we want a quality fish oil. Now, I've proven with blood testing what the best fish oil is, and that's the one that we use. It's from Designs for Health, who has, I think it's got they have a few different ones, but there's one that will raise omega-3s. I've proved it on blood testing more than anything else. So we got to get a good fish oil. Folic acid and B12, we definitely want to give folic acid and B12 to that mother. The mother should be getting some fruits, little fruits, lots of vegetables, good fats, and good protein. That's how we're going to have a healthy baby. You have to feed that baby. That baby's taking nutrients, and you have to feed the mother because the baby's taking nutrients, so the mother needs nutrients too. So that's while pregnant. That's what to do. That's how we do it. As soon as a woman gets pregnant in our program, that's what we're going to be given. And these babies come out, plump and healthy. They don't come out real skinny and scrawny. We're feeding them. We're giving them food. There's another thing we give, I think I wrote green food. We give them green food sometimes. Some women we give green food. So they get concentrated vegetables. So that's how we do it. I'm going to have 2 more videos on this. And one was going to be preventing miscarriage.